go to the companies that they tend to use used oils as their raw materials. So we tend to align with them and supervise how they can use them properly without causing other things that can harm the environment.
Okay. Yeah, referring to the first introduction, you promised that you could give more emphasis or more definition or clarification on this kind of hazardous waste that you are working with. What are they exactly?
Okay. Hazardous waste that we are working with includes the healthcare waste. That's one. And when we are talking healthcare waste, we mean the waste from the hospitals, the waste from pharmacies, the waste from these polyclinics, and so on. Also, another item in hazardous waste, we have, I mentioned earlier, that we have these expired chemicals. You know, we have a lot. So once those chemicals are expired, they are no longer for use, you see? So those are expired chemicals and to be termed as a waste. So those are hazardous waste we deal with. And also we have these expired drugs. You see, pharmacies, once they provided drug service to the community, if they are in time, they are not waste. But if they are outdated, they are waste. They are no longer for use for the people's health. So we term them as the hazardous waste. Also, there is another thing that we will come up in the discussion and hazardous waste. Because in the regulation, policy guidelines of our nation, even the salons produce healthcare waste, even the barber shops. But if today I go to the barber shop and say, oh, this is a hazardous waste, you need to dispose them in a proper way that is recommended by the government or recommended by the international conventions. He will or she will start wondering, what are you talking to you or to her? Okay, so hazardous waste in that sense are those non-garbages. Non-garbages. If are garbages, they are going to the landfill. No more landfill like Pugu, Kigogo, in Dar es Salaam. Those are garbages. But those we term as hazardous waste. Hazardous. They are not for Kigogo. Also, they are not for Pugu landfill. They should we will come up with disposed in a manner that cannot deteriorate the environment, cannot deteriorate our climate, cannot deteriorate and be a harmful cause of harmful to our people.
Yeah. Thank you once again. Yeah,
because in the regulation,
can we have a sense of applause for him?
Of our nation, even
once we are progressing and the other panelists, we are still waiting. When we are continuing, they will join us. But still, I can have more conversation with chairs as far as
salons produce
the angle how you work
waste.
With the
even the barber
facilities.
But if today I go to the barber shop and say, oh,
and
this is a hazardous
the challenges and the opportunities
by the government with healthcare facilities, by the international conventions, contract, okay, agreement. So hazardous waste will be serving you, collecting are those non-garbages, non-annuary. If are garbages, they are based on the landfill. And also, landfill like Pugu, Kigogo, in Dar es Salaam. those
to
are laboratories.
to measure
Those
the waste in terms of quantity.
So
there
not
are
for
the
Kigogo,
other
they are not
clients
for
that is
Purple,
aligned with our
they are
terms
that
that no,
we will
look,
come up
we
with
will
this
be
policy in a manner that
paying you,
cannot
or
deteriorate the
you'll
environment,
be
cannot
charging
deteriorate
us
our
per
climate,
month.
cannot
You'll be
deteriorate
charging
and
us
maybe
maybe
a harmful,
after 1
also
year.
harmful
We'll,
to our
we know our scale of payment. We'll be paying you like this. Like this.
Thank you. Thank
So
you once again.
we have
because in the
contracts,
regulation,
We have
healthcare.
a sense of applause.
For instance, I can share with you. We have contracts
once
with
we are
African
progressing
Hospital.
and
We have
other
contract with
other panelists, we are still waiting. When
the
we are continuing
healthcare
to join
of
us, but still I can have more conversations.
these polyclinics,
Pictures as far
several
as
polyclinics
the
in
how you
Bagara,
work
in
with
Temeke, in
even
Kariakor,
facilities.
But
Kinondoni,
if today I go to the
Kibaha,
barbershop and say,
we do
oh,
collect
Mr.
all the
Hazard,
challenges
healthcare waste. So, first of all, we tend to enter into a mutual agreement. We sign the contract that maybe you are, you know, there is these beginners. He or she want to establish the healthcare facility, polyclinic or hospital or dispensary. There is another, there's a government guideline that you should not establish this healthcare waste if you don't have a consultant who come to collect your waste. Okay, so once they come to ask our service, we enter into agreement,
With
and because they are
healthcare
beginners
facilities
and they don't produce enough of waste, we tend to grade the waste in terms of quantity. Maybe from 0 to 20, you'll be paying this, and they feel comfortable. We go like that. If the quantity increases, we revise the prices. Yes, it's just like that, very small.
Yeah, thanks. According to my experience and working with our community in cleaning
with healthcare facilities,
oceans, even around the ocean, or water resources, we've been facing a challenge of finding some of the hazardous waste in waterways. Maybe this could be part of the discussion to members of the floor on why and how this problem can be handled. While we have facilities.
Okay.
Also, for
So,
example, that Tindwa, you have a
hazardous
waste
waste will
management
be
system
serving
that
you,
you do.
collecting,
Why do we
and
have
those
these
have
hazardous
non-garbages.
especially having sharp objects
Non-annuary, if our garbages,
open
they're based on
environments,
the landfill,
including water
and
resources,
also landfill like
and,
Kipugu,
We tend
Kigogo,
So
in
I
the
will
rest
be
those are laboratories.
opening
Measure
now the
those
floor.
with
Waste in
that
terms
same
of
as
quantity.
hazardous
and then share
waste.
So
They're
there
not
are
for
the
Kigogo,
other
they're not
clients
for
that
Purple,
align
the way
with our
forward.
terms
they are
that
Best
that
way
we
we
no,
can handle
will
this.
come up
we
with
will
this
be
policy
As
in
we
a
refer
manner
our
paying
manifesto
you, or
introduction,
you will be
about
charging
15%
us per month.
cannot
of
You'll be charging us maybe
of waste that you
after
call
1 year.
healthcare.
We know
waste
our scale of
are
payment.
hazardous.
We'll be
The
paying you like
remaining
this.
80,
Thank you.
85%
So
Once again,
we have
because in the
contracts,
regulation,
we have
healthcare.
a sense of applause.
For instance, I can share with you, we have contracts
once
with
we are
African
progressing
Hospital.
and
We have
other
contracts
also
with
sometimes they
the
refer to the
panelists,
municipal
we are
waste.
still waiting. When
the
we are
So
healthcare
continuing
with
to join
of
us,
15%,
I can have
it
more
has
conversations.
these
huge
polyclinics,
challenge. Say we have
several
salons
polyclinics
produce
in
how you
Bagara,
objects
in
with,
Temeke,
will
in
lead to
Kariakor,
But
Kinondoni,
if today I go to the
Kibaha,
barbershop and
who
say,
we do
oh,
collect
Mr.
all
Hazard,
the
challenges
healthcare waste. So,
So, like
first
some
of all,
people
we
will
tend
raise hands so
to
they
enter
share the
into
list.
a mutual
Welcome.
agreement. We sign the contract that maybe you are, you know, there is these beginners. He or she want to establish the healthcare facility, polyclinic or hospital or dispensary.
Thank you, Henry. My name is Sarah Pema from
There is
organization
another,
called UDEFO.
there's
I would like
government
to
guideline
ask,
that you
we
should
can
not
have a
establish this healthcare waste if you
discussion
don't
about
have a
that
consultant
hazardous waste.
who come
We
to
do a lot of
collect your
cleanup,
waste.
like Henry
Okay,
said.
so
And when we are
once they
doing
come
waste
to
auditing,
ask
we found out like one
our
cleanup we
service,
get like
we enter into
300
agreement,
with
and
maybe
because they
for
are
all the
beginners and they
injections,
don't
the
produce now for
So
waste,
what are the
we
way
tend to
forward? Because
grade the waste
our
in terms
water
of
get
quantity.
contaminated and
Maybe
our
0
health is at
from
risk.
0 to
That's the
20,
first question.
you'll be paying
And the
this,
second question
and
is,
they feel
do
comfortable,
you have
we go
the
like
awareness
that. If
and
the
capacity
quantity
building
increases, we revise the
in
prices.
at Tindwa?
Yes, it's just
So
like that.
the community can understand, or
Yeah, according
is
to
it part of
thanks.
your
According to
CSR
my
to do the
experience
capacity
and
building?
working
How
with
or what can we
community
do so that the community
With
can
healthcare
understand and be in the
facilities,
same line?
oceans, even
The other
around
question is, we have
water resources,
diapers.
we've
We
been
found a
facing
lot
a
of
challenge
diapers
of finding
and
some of the hazardous
are not
waste
collected,
in
and they are not
waterways.
supposed to go to the
Maybe this
landfill.
could be part of the discussion.
So
member
what
of the
is
floor,
the way forward? Like you see
on
nowadays,
why
we have a
and
lot
how
of
this
diapers,
problem
and
can
diapers
be
are
handled.
not
While we have
biodegradable. So
we
what
have
is the way forward?
facilities.
Thank you.
okay.
Also, for
So
example, at Tindwa, you have a
hazardous
waste
waste will
management
be
system
serving
that
you
you're doing.
collect
Thank you,
what
Sala.
those
We'll be
have
taking
non-
hands, then we will respond.
having
Sometime also you
non-ordinary,
can share insight.
if
be at
garbages
open
that are going
environment.
to
Another hand,
landfill,
including water
and
resources.
also landfill.
Thank you.
We turn
My
to
name
in the
is
rest
Dansan
those are
Kapa.
garbage.
Opening
I'm
now
the
is
Those
of
with
the
waste
Government
that
Chemistry
are
Laboratory
hazardous
Authority,
share
Eastern Zone.
also
Directly replies. Yeah, I want firstly to introduce what we are doing in
our
promoting
manifesto
the
introduction.
Sorry,
Maybe 15%.
it's going to
crime
because we are all
still
part
charging
of
us
of waste that we
after 1 year,
healthcare.
we know our scale of payment will be paying you.
Remaining
So just
85%.
briefly,
Once again,
yeah, our work here as a regulator,
For instance, I can
we
share with you,
usually
we have
once we are
make
progressing,
registration of those who are dealing with the
and also sometimes
hazardous
partners
waste and the sector.
waiting other when we are
Because we
saying
regulatory laws,
15%,
we regulate the industrial and consumer chemical management laws, we regulate the human DNA laws, and we regulate the government chemistry laws. So from those laws, we promote this sustainability because we as a laboratory also we generate a lot of waste from the sampling,
First of all,
so we have the procedure for managing those waste. And as a regulator of industrial and consumer chemical, we register those importations, users, and distributors. So during the import, we are not allowed the importation of the waste
Thank you. Thank you,
in the
Chair.
country.
Thank you,
And
Henry.
if it's happened that the waste is generated,
For you, therefore,
we usually
I would
make
like
sure
to-
that those generation are going to the disposal facility which we have already issued the permit
we
for
do a lot of
disposal.
cleanup, like Henry
So
said.
in brief,
When we are
once
doing
they come
waste
to
audit,
ask
we
our-
find out
Thank
like
you.
one cleanup
Service
gets like
representative.
300
with
And because they are
healthcare
here,
facilities.
injections.
now for
So
waste,
what are
close
the
we
way
tend to
forward?
grade the
Because
waste
our
in terms
water
of
get
quantity.
contaminated and
Maybe
our
0
health is
from
risk.
0 to
That's the
20,
first
you'll
question.
be paying
And the
this,
second
Another hand
question
and
is,
they feel
do
comfortable,
you have
we
the
go like
awareness
that. If
and
the
capacity
quantity
building
increases, we revise the prices.
at Tindwa?
Yes, it's just
So
like that.
the community can understand, or
Yeah, according
is
to
it part of
thanks.
your
According to
CSR
my
to do the
experience
capacity
and
building?
working
How
with
or what can
community.
we do?
good
so
morning.
that the
My name is Joanna
community
Thomas
can
from
healthcare
be
facilities.
in
to
the
Dar es
same
Salaam.
line?
Oceans.
In
The
Aga
other
Khan, we
question
have
is, we have
water
diapers.
initiative
We
We've been
found a
facing
lot
about
of diapers
finding
clinical
hazardous-
waste
some of the
and
hazardous
are not
waste.
collected, and they are not supposed to go
we
to
say
the
non-infectious waste
landfill.
or general
Be part
waste.
of the discussion.
And
So
also we
what
have
is
an
the way
initiative
forward, like you see
to
nowadays?
clean
We have
along
a
the
lot of
beach
diapers,
near our
and
hospital.
diapers are
I remember 2 years back we had a plan, went through planting trees all over our beach.
Hazardous waste will be serving
What
you
I see
Thank you, Sala.
the
We'll
other
be
side
taking
that
hands, then we will respond. Sometime
is
also
that
you can
Tanzania
share
we need
insight.
to have an initiative how we
garbages
can
that are going to
ensure that
including water
we
also
sustain our
landfill.
environment.
We turn
One of the issues that I see
those
that
are garbage.
the sensitization to the community need to be groomed, need to be improved so that people knows what to do. Like we have, like my sister would say, there is a lot of material along the beach. If you check, those who are not supposed to be there, they are affecting our environment, and people are just throwing whatever, and really it's damaging
we know our scale of payment.
I think
So just
in support of the government, we need to sensitize the community in Tanzania. If you go in a suburb area, in a local area there, let's say Manzese, Mbagala, you see a lot of waste. And people, they don't know what they are doing. They just throw bottles, plastic bags, of which really they are destroying our environment. So I think this, yes, I said about the government, but everyone need to know we are part of it as a Tanzania. If you check, like the damage that we are causing to our environment, too huge. We are affecting. You see, like in our institution, we have a plan for whatever that we are producing. Even our technology, we have started changing it in terms of AC that we are using. We know that they are emitting a lot of carbon, so we have a plan with net zero. We are planning that in a certain, after a few years, we should reduce the amount of carbon that we are generating. Like the technology, we have even involved our suppliers that we are working with, those who are supplying medications, equipments. We involve them that please, you need to be part to the environment, so that you need to work with the agriculture. You have to be you have to work with the environment as well. You need to ensure that you maintain the environment. So
my experience,
I think this need to be
good morning. My name is John
companies. Because really, if you check Tindwa, yes, we are working with the Tindwa in our main hospital. We are working with the Tindwa in our outreach with the infectious waste, with the clinical waste and non-infectious waste. But we have a lot of waste that they were supposed previously they were going to landfill, but now we have started. We sort paper, paper boxes. We recycle it. They are going back to the industries. We sort bottles. These bottles, we don't throw away bottles. The other side are going back to the industries. Then we have started again other plastic cartridges as well. We don't throw it away. One of the issues that I see is the sensitization to the community.
just not
Need to be improved. People knows what to do. Like we have, like my sister would say, there is a lot of material on the beach. If you check, those who are not supposed to be there, they are affecting our environment, and people are just throwing whatever, and really is damaging. I think in support of the government, we need to sensitize the community in Tanzania. If you go in a suburb area, in a local area there, let's say Manzese, Mbagala, you see a lot of waste. And people, they don't know what they are doing. They just throw bottles, plastic bags, of which really they are destroying our environment. So I think this, yes, I said about the government, but everyone need to know we are part of it as a Tanzania. If you check, like the damage that we are causing to our environment, too huge. We are affecting. You see, like in our institution, we have a plan for whatever that we are producing. Even our technology, we have started changing it in terms of AC that we are using. We know that they are emitting a lot of carbon, so we have a plan with net zero. We are planning that in a certain, after a few years, we should reduce the amount of carbon that we are generating. Like the technology, we have even involved our suppliers that we are working with, those who are supplying medications, equipments. We involve them that please, you need to take, you need to be part to the environment, so that you need to work with the agriculture. You have to be you have to work with the environment as well. You need to ensure that you maintain the environment. So I think this needs to be
Good morning, my name
for
is
all
John
companies.
Thomas.
Because really, if you check Tindwa, yes, we are working with the Tindwa in our main hospital. We are working with the Tindwa in our outreach. With the infectious waste, with the clinical waste and non-infectious waste. We have a lot of waste that they were supposed, previously they were going to landfill. But now we have started, we sort paper, you know, paper boxes, we recycle it, they are going back to the industries. We sort bottles, these bottles, throw away bottles, the other days are going back to the industry. Then we have started again other planning these cartridges is what we don't throw it off. The issue that I see in our sensitization to the community need to be improved, so that people knows what to do. Like we have, like my sister would say, there is a lot of material on the beach. If you check, those who are not supposed to be there, they are affecting our environment, and people are just throwing whatever, and really is damaging. I think in support of the government, we need to sensitize the community in Tanzania. If you go in a suburb area, in a local area there, Manzese, Bagala, you see a lot of waste. People, they don't know what they are doing. They just throw bottles, plastic bags, which really they are destroying our environment. So I think this, yes, I said about the government, but everyone needs to know we are part of it. Tanzania. If you check, like the damage that we are causing to our environment, we are affecting. You see, like in our we have a plan for whatever that we are producing. Even our technology, we have started changing it in terms of technology that we are using. We know that they are emitting a lot of carbon, so we have a plan with net zero. We are planning that in a certain, after a few years, we should reduce the amount of carbon that we are generating. Like the technology, we have even involved our suppliers that we are working with, those who are supplying medications, equipment. We involve them that please, you need to take, you need to be part to the environment, so that you need to work with the agriculture. You have to be you have to work with the environment as well. You need to ensure that you maintain the environment. So I think this needs to be
Good morning, my name
for
is
all
John
companies.
Thomas.
Because really, if you check Tindwa, yes, we are working with the Tindwa in our main hospital. We are working with the Tindwa in our outreach, with the infectious waste, with the clinical waste and non-infectious waste. We have a lot of waste that they were supposed, previously they were going to landfill, but now we have started, we sort paper, you know, paper boxes, we recycle it, they are going back to the industries. We sort bottles, these bottles, throw away bottles, the other days are going back to the industry. Then we have started again other planning these cartridges is what we don't throw it off. The issue that I see in the sensitization to the community need to be improved, so that people knows what to do. Like we have, like my sister would say, there is a lot of material on the beach. If you check, those who are not supposed to be there, they are affecting our environment, and people are just throwing whatever, and really is damaging. I think in support of the government, we need to sensitize the community in Tanzania. If you go in a suburb area, in a local area there, those Manzese, Bagala, you see a lot of waste. People, they don't know what they are doing. They just throw bottles, plastic bags, of which really they are destroying our environment. So I think this, yes, I said about the government, that everyone need to know we are part of Tanzania. If you check, like the damage that we are causing to our environment, we are affecting. You see, like in our we have a plan for whatever that we are producing. Even our technology, we have started changing it in terms of fuel that we are using. We know that they are emitting a lot of carbon, so we have a plan of net zero. We are planning that in a certain, after a few years, we should reduce the amount of carbon that we are generating. Like the technology, we have even involved our suppliers that we are working with, those who are supplying medications, equipment. We involve them that please, you need to be part to the environment. So that you need to work with the agriculture. You have to be you have to work with the environment as well. You need to ensure that you maintain the environment. So I think this needs to be
good morning, my name is John.
companies. Because really, if you check Tindwa, yes, we are working with the Tindwa in our main hospital. We are working with the Tindwa in our outreach, with the infectious waste, with the clinical waste. But we have a lot of waste that they were supposed previously they were going to landfill. But now we have started. We sort paper, paper boxes. We recycle it. They are going back to the industries. We sort bottles. These bottles, they throw away bottles. The other day are going back to the industries. Then we have started other planning countries is what we don't throw it into the issue that I see the sensitization to the community. Need to be people knows what to do. Like we have like my sister would say there is a lot of material in the beach future. Those who are not supposed to be there, they are affecting our environment, and people are just throwing whatever, and really is damaging. I think in support of the government, we need to sensitize the community in Tanzania. If you go in a suburb area, in a local area there, those Manzese, Bagala, you see a lot of waste. People, they don't know what they are doing. They just throw bottles, plastic bags, which really they are destroying our environment. So I think this, yes, I said about the government, that everyone need to know we are part of Tanzania. If you check, like the damage that we are causing to our environment, we are affecting. You see, like we have a plan for whatever that we are producing. Even our technology, we have started changing it in terms of fuel that we are using. We know that they are emitting a lot of carbon, so we have a plan of net zero. We are planning that in a certain, after a few years, we should reduce the amount of carbon that we are generating. Like the technology, we have even involved our suppliers that we are working with, those who are supplying medications, equipment. We involve them that please, you need to be part to the environment. So that you need to work with the agriculture. You have to be you have to work with the environment as well. You need to ensure that you maintain the environment. So